everyone. We have a patient whose primary complaint remains jowling over the lower part of the face. As we can see, it's quite apparent. He has a laxity of skin on both the sides, especially around the jawline. Also on the profile, if you can turn to one side, we see not so much this. The chin is way receded. It is inside. It is small and it is receded. Compared to the other features of the face, the lower third looks horizontally deficient. It will look a little straight. So what we have planned for him is a genioplasty and a jaw sculpting, and we essentially also aim to restore the skin tone. Basically, the laxity of the skin should go. The jowling over here should go. Right?
Yeah.
Slowly I'll do. Give on the. Yeah, this is a little painful
This is
thing.
the more to the surgery.
Yeah.
And even the, I think intubation part is, I think, very harsh here.
मुझे काटा मरना चल रहा है.
Huh?
Yeah. Intubation. काटा भी चल रहा है. आडियो चिके मरचे. Say just show this thing. Sorry. Just one more inch maybe. Is this slightly better from that side or both are same?
Same.
Okay, sorry. Over. Just the last bit. It's fully soaked actually.
I know, but still.
Yeah, but still a little bit. As slow as I can. Yeah, it's fully soaked. It's probably a little less painful if I just come from that side on. So we're done. Okay. And no, you can just stay there. I'm going to show you first. So, okay. So you can see the difference. And so the chin, pretty clear. Okay, just hold that. So you can see the difference here. We've done a genioplasty with jaw sculpting, and you can see there's a lot of improvement in the entire area. So can you look towards me, please? Yeah, thank you. That's superb. 1 second. We're going to show you that view now, and you will be amazed to see the improvement. Look at that. So there was literally so this was the chin earlier. There was a lot of fat. That was like a double chin going all the way jowl. It's got a nice contouring already. This is going to go in as it heals, and you can see the impact, the difference it's made. We're also going to show you some other view. And look at that. So you can turn the other side now. So you can see this. It's a little bit more towards your left. Thank you. So you can see this now. There's a classical double chin there. The chin was not tight. There's a lot of laxity here. So what exactly happens when we do this genioplasty with jaw sculpting? I keep mentioning there are multiple things that happens, and when we make a cut like posterior and get the bone forward, of course, I like to call it as a reverse facelift effect. It gets the tissues around the bones to get taut, to get tight, to stretch out. And when that happens, these are the kind of changes you will see. The double chin disappears, face looks more youthful, and obviously we are already improving the facial aesthetics by correcting the proportions. So these are all the added benefits. A couple of other good things also happen when this is done. One is the patient's breathing, and next is the patient's sleep. Both of these also improve. There are multiple different types of genioplasties available out there. Depending on what we need to select the right type of procedure to augment and at the same time the added benefits that I've just mentioned. So once again, a look at this view. I have not yet shown this to the patient. As you can see, I'm still going to freak out. He's going to be very happy once we show him. But that's after we record this short video. Okay. And you can see some more pictures. Look at that. That's a half view. Again, you can see the improvement. Look at this angle. So the improvement is all the way up to the neck, as you can so visibly, so clearly see. The jowl area has got in. It's literally disappeared. The large double chin. The chin has come much forward, a little bit of a height. This area has become taut and tight. All right. Thank you.